Hi there. Yeah, I want to say thank you for joining us again today. We're going to go through the presentation of navigating the Medicare maze. All right, so let me get started here. Let me share my screen. Give me just 1 second. Okay, so here we go. So I do have to give you a quick disclaimer. This is a disclaimer that Medicare requires that we read on every single call, every presentation, basically just letting you know that we do not offer every Medicare Advantage plan in the area here. We represent 8 organizations which offer 80 products. On the Medicare Part D side, we do not offer every Medicare Part D plan. We currently represent 7 organizations, which has 20 different products. Please contact 1-800-Medicare, Medicare.gov, or your local state health insurance program to get information on all of your options. So once we basically do the disclaimer, then we'll move on here and start in with the program. So what the questions I like to ask is, and these are the questions that are the feelings I guess people say to me, is they want to feel confident in their Medicare decisions. So I got just 3 questions for you. Do you want to feel confident with your Medicare decisions? Do you want the peace of mind when it comes to Medicare? And do you want to make sure that you're protected from all Medicare penalties? Well, here in just a couple of minutes, I'm going to share with you how to go from the transition of feeling confused, frustrated, overwhelmed by all the mail you're getting, all the phone calls, all the emails. And I'm going to give you a clear path to know that you've avoided all of your penalties and know that you're choosing the right plan, the best plan that fits your needs. Again, my name is Suzanne McLean, and I am going to do Welcome to Navigating the Medicare Maze, where we put the joy in the Medicare process. So the one question I have for you is, do you like when something steals your joy? Because I do not. And what I find is sometimes clients will call and say, I'm so overwhelmed, I'm so frustrated because I have all these calls, all these mailers coming into me. I'm just not sure what to do. And what I see is that steals your joy. So my job is to put that joy back in your life. A little bit about me is I believe that it is my God-given mission to help others, especially when life gets complicated. Retiring, going on Medicare, making healthcare decisions definitely is when life is starting to get complicated. I love to see people win. So when you're like, you get off the phone with us or you get out of the Zoom and you're like, oh, I understand everything. We see that win on your face. That definitely lets us know that we are accomplishing our mission in life. So what we're going to do is I'm going to talk just a little bit about my team here. There's a team of 6 of us. We have a little over 4,000 clients, and we've been doing Medicare for about 15 years. So when you call into our office, you'll probably talk to one of these smiling faces here, and they will take wonderful care of you. All right, so every year we do bring on a little over 400 new clients, and we help those clients go through the navigating the Medicare maze process. We do have a live event that we hold each year where we invite our clients to come to that live event where we'll bring a speaker or somebody to come in and talk about things that is beneficial to you as the consumer. So our event is actually coming up here in May of this year, and you'll be getting the invites to that if you're interested in coming. All of my clients do get a copy of Navigating the Medicare Maze. And anybody that's on this webinar today, I will be more than happy to send you a free copy of the Navigating the Medicare Maze book that I wrote. All you have to do is reach out to my office and give us your address, and we'll go ahead and drop the book in the mail to you. Basically, what this book is I compiled a list of, a book of client stories that basically, it's a pretty simple read. I think most clients are telling me they can read it in about 45 minutes. And it's the success stories of my clients. So I will absolutely send any of you a copy of this book. Now, one of my most prized endorsements is we are designated as the official Medicare advisor of the Columbus Bar Association. So we work with a lot of attorneys. We work very closely with the bar, with any of their, people that are turning 65, retiring, walking them through the process of going through that navigating the Medicare maze to give them that peace of mind of knowing that they've made all the right decisions. Now, once a year, we do go to Washington, D.C., where I weigh in on Medicare legislation. So I tell everybody that I talk to about this, we go every February. I tell your stories. So let me just give you an example. Last year, as I was sitting there talking to the congressman, we have certain topics that we talk about. And it was so interesting because he was sitting right next to me, like so close. I literally kind of touched his leg and I said, how would you feel if your parents or your grandparents had to go through this? And I told a story about how one of my clients had had an issue with one of their medications. And I told another story about how one of my clients had been put into the hospital. And then from the hospital, they got sent to a skilled nursing facility. But unfortunately, that client was not admitted, quote, admitted to the hospital. They were only in under observation. Well, they thought they were admitted to the hospital because they had the wristbands on and everything, and they were in a bed. Then they got sent over to a skilled facility to start, going through the rehab process. And Medicare declined the claim because they were not admitted to the hospital. And that's something we're trying to work on with legislation, is making sure that the consumer knows if they're admitted or under observation, so the client doesn't have any surprises. But anyways, so every year we go over and I tell these stories. I'm very, very authentic about saying this is what our clients deal with. I call it my boots on the grounds. I'm walking around, I'm meeting with people, I'm talking to people, and I'm hearing those stories. And I love to share those stories to congressmen and try to positively help legislation. Now, this is just a little bit about me. This is my family here. My mom and dad right back here. And then, of course, a lot of my siblings, my nieces, nephews, etc. So a little bit about me is I was raised one of 5 kids. My dad and mom were very passionate about helping others through the service of God. So my dad is a minister, and his desire to work for God was stronger than his desire to climb up the corporate ladder. So yes, he was a businessman before he retired, and he was a minister. As I seen him climb up the corporate ladder, I would see him go out and take on another small congregation to try to help build that church. And I really never understood it as a child. I really didn't, until I started growing up. And I'll never forget that the passion in me was always to help somebody, but I really couldn't figure out why. Well, because I had such an example in front of me of my parents always helping people. And I remember I was probably in my early 20s. And of course, this is before Ring Doorbell. And I remember there was a group of us girls that got together, and there was a minister, him and his family, and they had a couple of kids. They were kind of struggling financially. And I just remember thinking, what can I do to help them? Because I was raised in a preacher's home. And I was like, what can I do to help? So a group of us got together. We went to the grocery store and we just bought some groceries. Like I said, I was probably in my early 20s. And we bought the groceries. We went over to his house. We dropped the groceries on the porch. We rang the doorbell once again before Ring Doorbell. We rang the doorbell and we took off. And I remember that feeling of, oh my word, I love to help people. And as I was growing up, as I'm getting older, I'm like, how can I use my God-given mission to really help people? So you might ask, like, well, how does that correlate with Medicare? Why are you so passionate about Medicare? Well, let me explain exactly why I'm so passionate about Medicare. So about 15 years ago or so, my husband and I went over to visit his parents. And his parents, this is his father here. His parents his dad had retired from the federal government, so he had a retiree insurance. And his dad at the time was about 70 years old. And I was not in Medicare yet. But I had done insurance in the past. So I had some insurance background. So we're sitting there chatting. And as we're chatting, he's like, Suzanne, I just don't know if I have my Medicare right. I just don't know. And I always jokingly tease him because I always call him a seminar junkie, because he would go from one company seminar to, Anthems, Aetna's, Humana's, Medical's. He loved to go to all these different seminars. And of course, they kind of told him different things because his situation was so unique. So what we decided to do, my husband and I decided, is we were going to sit down and we were going to make sure that he and my mother-in-law was taken care of and had made the right decisions. Well, basically after the dust settled, we popped his little, DVD into the computer and it showed us all of his benefits. After we discovered he should have signed up for Medicare Part B and he had not done that. We don't know. We weren't there. We don't know if he wasn't advised. We don't know if he didn't understand. We really just didn't know. But what we do know is that he didn't sign up for Part B of Medicare. So we helped him sign up for the Part B of Medicare. And unfortunately, fast forward all the way up, we've been doing this now for about 15 years. To this very day, he's 85 years old, and he and my mother-in-law are still paying late enrollment penalties because they did not sign up for Medicare Part B when they needed to. Now, everybody's situation is very unique. That's why you need to speak to somebody about your specific situation. But his situation was he and my mother-in-law needed to sign up for Part B, and they did not do that. So to this very day, they're both still paying that late enrollment penalty for Part B. It's so sad to me because I feel like it could have been prevented if A, he would have understood, or if he'd been told, and I really don't know. But my job and my God-given mission is to help make this not so complicated for you and make sure that we make you feel like that those penalties were taken care of, making sure you don't get assessed any penalties. But after that is when I really realized that my passion was sparked by this is how I can help people. And fast forward, I got into Medicare. And this is exactly why I'm so passionate about Medicare, because I've seen it firsthand and I still see it every day with my in-laws with what has happened in their situation. So what we're going to do is we're going to go ahead and start with the Medicare Joy process. So I've broken it down. Let's talk about the J. So the J is part of, I would call it the jigsaw puzzle pieces. So as you can see, you see all these jigsaw puzzle pieces here. Some are flipped up, some are flipped down. Everybody's situation is so unique. And that's why you have to have an advisor that looks at your specific situation. So if you're like me, you kind of take a puzzle, if you're going to do a jigsaw puzzle, you dump it out and then you flip all the pieces the right side up and you say, okay, now what makes sense here? So what we're going to do is we're going to go through some of these pieces of the jigsaw puzzle. Okay. So each one of these pieces of the jigsaw is moving pieces. Okay. So for example, we need to know who your doctors are. We need to know if you're on an employer plan. We need to know how you file your taxes, because the way you file your taxes determines how much money you pay for your Part B premium of Medicare. Are you drawing Social Security? Do you have any pre-existing conditions we need to talk about? Do you have prescription drugs? And if so, what are they? Do you have a spouse on your plan? Do you contribute to a health savings account? What's your income? And of course, do you like to travel? So these are just different puzzle pieces. And unfortunately, the puzzle pieces, it's not a one fits all, because the puzzle pieces can change every single year based on your situation. So what I'm going to do is I'm going to go through a couple of these puzzle pieces and we're going to kind of dissect it as we're starting to build the puzzle. So for example, how you file your taxes and what your income is what your Part B of monthly premium is. Okay, so let me show you. This is how Medicare Part B, and I'll go through each part here in a minute. This is how Medicare Part B dictates what you pay. Okay, so when you sign up for Medicare Part B, Medicare, Social Security, goes out and they pull your income tax return. This is why we need to know what your income is. They pull your return from 2 years prior. So right now we're in 2024. They're looking at your 2022 return. Okay. So in your 2022 return, basically the way that it works is we're looking here at the joint. Let's say you do a joint return. If you make $206,000 or less, your Part B premium is going to be $174.70. That's if you do a joint return. But let's say, for example, you make a higher income. As you can see, that rate goes up based on what your income is. Now, I had a client come to me and they were married, but they filed a separate tax return. Okay. And unfortunately, both of those, the husband and wife, both were over like $105,000. So together they were around 200,000, but they had done a married but separate return. So when they came to me, I had to tell them, well, based on the way that you filed, you're at 103 to 397 because each of them was over 105. They each had to pay the $559 each. Whereas if they would have filed a joint tax return, both of them being under or around 105, they would have been at this number, which would have made their premium at $244.60. So it is very important when you're filing your income taxes to know how it's going to affect you when you go on Medicare Part B. So if you have an accountant or a CPA that you work with, this is a conversation that you need to make sure that you're having with them to make sure that it doesn't hurt you in the future. So excuse me, I have clients that would come to me at 63 or 65, and I'm like, well, the way you filed at 63 made a big difference. So if you're, under 65 right now, watching this webinar here or watching this video, then what you need to do is make sure that you're taking all this into consideration while you're filing your taxes prior to age 65. And even going forward, because every year Medicare goes back 2 years. So like in 2025, they're going to look at your 23 return. In 26, they're going to look at your 24 return and so on. So that's why we have one of those puzzle pieces that's so very important that we need to know when we're helping you determine what the best thing is for you. Okay, so the next thing we're going to talk about here is an HSA, which is a health savings account. I get this question quite often because people are currently working and they have an HSA where they contribute funds to that health savings account. Of course, it's tax deductible. There are certain rules within your HSA. If you are the employee and you are on any portion of Medicare, you cannot contribute to an HSA if you're on Medicare and you're the employee. So therefore, you cannot contribute to an HSA. Now, if you're not on Medicare, and this gets a little tricky right here. So let's say at 65, you decide to stay on your employer plan, not go on Medicare, but at 70 years old, at that point, you decide to go on Medicare. You must stop contributing to your HSA 6 months before you go on to Medicare. And that's a question I get quite often is, well, does that 6 months really apply to like 64 and a half, or is it really 6 months at a later date? Well, really that 6 months is a later date. So that what I'm saying is if you do not go on Medicare at 65, but let's say you go on it at 68 or you go on it at 70, the way that it works is they back your Part A date up 6 months. Therefore, you must stop contributing to your HSA. All right, now I do see a couple questions coming in the chat. If you don't mind, we're just going to hold those questions here to the end and then I'll answer the questions. But if you have questions along the way, please feel free to put them in the chat and then we'll answer them here at the end. All right, so what are other jigsaw puzzle pieces that are very important to your puzzle? So remember, each one of these things we have to know in order to advise you. So when you're setting up an appointment with our office, these are the questions that we start asking you because we need to make sure we have a very clear picture to where we know what works best for you and which one of your puzzle pieces is moving. Okay, so now we're going to look at the O, which is the O in the joy, which is creating your outline. So if you're like me and you're creating a puzzle, typically what I do is put them all on the table, then I take all your flat pieces and I create my border or my outline. So now we've created the outline and now we're going to go ahead and fill in, which is really your options. So question is, well, Suzanne, what is Medicare? I mean, I hear it. Sometimes I think people tell me it's free. I don't even know what it is. Well, let me tell you here. So Medicare Part A covers inpatient hospital care. So that's basically laying in a hospital bed. It covers skilled care or rehab. Of course, you have to be getting better. It's not where you're going in for like custodial care. So Part A is your inpatient care. Generally, there's no cost to it as long as you've worked for 40 quarters, which is basically 10 years. So as long as you've worked for 10 years or 40 quarters, generally there's no cost to it. Now, Part B of Medicare, B as in boy here, covers your outpatient, doctor visits, x-rays, CAT scans, MRIs, basically anywhere where you go and have something done and then you come back. So it's an outpatient service. Now, Medicare Part B is covered at 80%. So Medicare covers 80% for Part B services. The monthly cost for it, like you saw on the slide prior, starts for this year at $174.70 per person. Remember, it goes up with your income. Now, Part A services is not covered like Part B, 80-20. Part A is not covered at 80%. Part A is covered by deductibles and coinsurance. Part B is covered by 80%. Okay. Now, the way that I kind of explain your Medicare Part A and Part B is kind of like a piece of Swiss cheese. Now, you're going to learn this about me. I'm a very visual person. So I had to put my Swiss cheese out there so I could say, okay, what does Swiss cheese remind me of? It reminds me of a lot of holes. So Medicare Part A and B gives you coverage, but there's a lot of holes, just like there is in Swiss cheese, that we need to protect ourselves. So our options would be going with a Medicare supplement, also known as a Medigap plan or a Medicare Advantage. I'm sure you've heard those phrases out there. Medicare Advantage, Medicare Supplement, Medigap. Remember, the Medigap and the Medicare Supplement mean the same thing, just two different words. Medicare Advantage is something completely different. We're going to go through that. So basically the way it works, let's talk about the Medicare Supplement or the Medigap first, okay? So your Medicare Supplement plan, basically the way it works, those plans are through private insurance companies. So like Anthem, Aetna, United, Humana, there's a ton of insurance companies that provide these type of plans. Okay, so they're administered through a private insurance company. So if you was to purchase or enroll in a Medicare Supplement or a Medigap plan, basically what it is you're saying, I want my Medicare A and B to be my primary insurance that will pay first. And then I'm going to, so your Medicare pays first. And then your supplemental insurance kicks in and kind of fills those holes of that Swiss cheese. Okay. So let's take a look here. Now, as you're looking, this chart is a lot of the plans that are available to you. And I've had ones just say, oh, Suzanne, it's so overwhelming. There's so many choices. So I tried to break it down and make it very simple. You have plans A through plan N as in Nancy. As you can see, they all cover different things. In my opinion, the most comprehensive plan for people now turning 65 is your plan G as in girl. So if you look at G, you can see all these check marks. Basically what that means is with these check marks, this plan is filling the holes of that Swiss cheese. So it's filling all of those copays and deductibles on the Part A side. And then it's filling the other 20%, except for this little one right here, which says your deductible on the Part B side. Now this deductible for 2024 is $240. So once that deductible is reached, as long as it's a Medicare covered event, you have 100% coverage for your inpatient and your outpatient care with this plan being your supplemental insurance. So let me go through that one more time. The plan G will cover all of your Part A coinsurance and deductibles. It covers the other 20% on the Part B with the exception of that $240 deductible. Okay. Now, With this particular plan, the traditional Medicare modernized supplemental plan, you can go to any doctor, any hospital that takes Medicare. So what you need to remember is any doctor or hospital that takes Medicare, you can use them. The supplement Medigap plan will not cover if Medicare does not cover. So if you have something done that Medicare says, we're not going to cover that, your supplement is not going to cover, because remember, the supplement is piggybacks on Medicare. So Medicare has to pay in order for the supplement to pay. Now, your supplemental insurance is based on age, gender, demographic, of course, what insurance company you choose. And I wish I could say it's not true, but it is true. Rates go up every single year. You're always going to see a rate change as you age. So just to let you know that. Now, what are some things that Medicare supplements do not cover? Well, I'll tell you right now, Medicare supplement does not cover Part D prescription drugs. So I've had clients say, hey, Suzanne, well, Medicare Part D, is that through the government or is it through an insurance company? How does that work? Because it's known as Medicare Part D, as in drug, many people assume it's through the government, and it's not. It is through a private insurance company. Once again, examples, Anthem, Aetna, Humana, SilverScript, and the list goes on and on. Those are just some of them that I can tell you off the top of my head. So if you do the supplemental insurance, you would want to do the prescription drug coverage separately because they don't come together in order to have pharmacy drug coverage. Now, what we do is we together take your prescriptions and we look at your dosage, quantity, what pharmacy you use, and your specific medication, and we say, which drug plan makes the most sense for you? Okay, because some people will say, well, Suzanne, just put me on the best drug plan out there. Well, it doesn't work that way. It's which one is the best for your mix of medications. So once again, as you can see here, this puzzle piece is one that very commonly changes. It can change year to year because it's based on your medications. Well, you and I both know that typically your medications can fluctuate throughout the year. So what we do is we determine which drug plan, and that's what we would put you on for that year. Now, I want to make sure that we talk about the Medicare donut hole. Now, a lot of times I'll hear people say, I'll ask them, so do you know what the donut hole is? And they're like, I've heard of it, but I really don't understand it. Now, in 2025, this is going to be different, but this is what it is for 2024. So I want to make sure that we talk about it. Okay. So on the prescription drug side, here's how it typically works. Most drug plans have a $545 deductible that you have to pay before the insurance kicks in. Okay. On most plans, not all, but most. Now, then you go into what they call the initial coverage phase. So really, as you can see here, there's 4 phases: your deductible, initial, coverage gap, and catastrophic. Okay. So when you go into your initial coverage phase, here's how it works. So each year, now 2024, the number is $5,030. So each year the government gives you, and I kind of call it, once again, I'm a visual person, a pot of money. Okay. It's $5,030 this year. So they give you this pot of money. You really don't see it, but it's calculated for you. You go to the pharmacy, and let's say that you take a medication that retails costs at like $500, just for my example here. So $500 drug. Let's say that the insurance says, okay, well, we'll cover $400, but you have to pay $100 at the pharmacy when you pick it up. So you're paying $100. The insurance company is paying $400 for a total cost of $500. Well, that total cost of $500 is taken out of this pot of money. So think about it. If you are using one drug that costs $500, you're going to eat that $5,030 up before the year's out. What if you're on 2 medications that are $500 each? Then you're certainly going to use this up early in the year. Once the $5,030 is reached, that's the total amount paid, what you pay and the insurance company pays. Once you've paid that, once this has been used up, you go into what they call the coverage gap. While you're in the coverage gap, you now are paying 25% of that retail drug. So for example, the $500 drug, let's say you were only paying $100. Now you're paying 125 because that's 25% of 500. So many times I'll hear clients say, well, I fell in the donut hole. My drugs just went up so high because they went from paying a regular copay to now typically paying 25%. So you might say, well, how long am I in that coverage gap? Well, you're in the coverage gap till either January 1st comes around and it starts back over, or until the true out-of-pocket reaches $8,000. So you might say, well, does that mean I have to pay the full $8,000? No, you do get subsidy while you're in here. You're paying 25%. There's a percentage being subsidized. And when the true out-of-pocket reaches $8,000, then you exit the donut hole and go into catastrophic coverage. And for 2024, this is brand new. Once you hit the catastrophic coverage, you now pay $0 for all of your medications, any covered medication. So I like to make sure that this is explained very well, because I have clients this definitely affects them. So that's if you have, so let's kind of recap. You have your Medicare supplement or Medigap option in your prescription drugs. So you would have your traditional Medicare A and B that would pay or pay first, your supplemental, which would pay second. And of course, this is your pharmacy. So you really have three different things if you choose the Medicare supplement Medigap route. Now let's get into Medicare Advantage. Medicare Advantage, a lot of times these are the ones that you might see that the ads on TV or a flyer in the mail that says, buy this plan for a $0 cost. And you get all of these extra benefits. The first question that people ask me is, well, is this legitimate? Is it a scam? I mean, how do you get something for nothing? Well, it is legitimate. It's not a scam. You just have to understand how the plan works. So we're going to go through it together. Okay. So you must have Medicare Part A and B in order to get a Medicare Advantage plan. And you must continue to pay the Part B. Remember, I told you it was $174.40 for 2024. You still have to be paying that Part B. So I have ones call me and say, well, I don't pay anything for anything. Well, if you're drawing Social Security, the Part B comes directly out of your Social Security account. So sometimes people are paying that Part B premium. They really don't even realize it because it's coming directly out of their Social Security account. Okay. So the way that Medicare Advantage plans work, they're known as Medicare Part C as in Charlie. So a lot of clients will say, well, does that mean I need to get C with the government? No, because this is a private insurance company, but it's known by Part C of Medicare. Okay. So all of your benefits are administered through the private insurance company. Okay. Here's the way it works. So you have your Medicare A and B through the federal government. They continue to collect your money for the Part B out of your Social Security check, or if they bill you, if you're not drawing Social Security, they add funds to your money that they've collected and they send it to whatever Advantage company that you've chosen. Okay. So you've chosen a Medicare Advantage company. Now that Advantage company dictates your premiums and your copays, out-of-pocket expense. So now your insurance carrier, not Medicare, but the insurance carrier, if you go with a Medicare Advantage, they are now telling you the best places to go based on getting the best money for, or the cheapest, how do I say it? The lowest copays, or what networks you have to stay within. Okay. So sometimes you'll see an ad or a flyer or something come back and say, well, this is a $0 monthly cost or a low monthly premium. So a lot of these have low premiums. They combine together your Part A, which is your inpatient hospital, your Part B, which is your outpatient, and your Part D is in drugs. They combine them all to one card. Okay. When you go to the doctor or hospital, you're presenting one card. Now, with those plans, typically they have a network of providers. So you pay copays for medical services as long as you stay in the network. You typically get a lower cost that you have to pay. Now, some plans allow you to go in or out of network. It all kind of depends. But Most of these plans have a network of providers they want you to stay within for you to get the best deal. Now, lower premiums typically equal a higher out-of-pocket maximum. So what that means is typically if the premium is low, they're saying, okay, well, if you go have an x-ray done or a open heart surgery, or I'm just giving you some examples, a hip replacement, you're going to have to pay some of that cost sharing. So what we're going to do is we're going to tell you, you have to pay co-pays on all of these services or most of these services. What we'll do is we'll give you a maximum out of pocket that you're responsible for. So if you had a horrible catastrophic year, most cases you don't go bankrupt because they have this max out of pocket. Now I've seen $3,500 max clear up to $10,000 max. It all depends on what plan you choose. Okay, so lower premiums typically gives you a higher out of pocket. Now, one might ask me, well, Suzanne, what do you think? What's right? Which one's right? What's right? What's the right plan for me? So the way I kind of look at it is there's not a right or wrong. It's which one fits you the best. And you have to make sure you understand the rules. So once again, I'm a visual person. So think of this ladder. So here we are with this ladder. At the very top of the ladder, we have what the most comprehensive coverage would be your Medicare supplement plan that we talked about. At the very top of the ladder, because you really can't get more comprehensive coverage. Your Medicare Advantage would be down the ladder because your Medicare Advantage is technically a downgrade because you're assuming more responsibility. Okay. So one thing that you have to think about is when you turn 65 or when you're going on Medicare, you really need to look between the two different options and make sure you're making the right decision. Because let me give you an example. Let's say that you tell me, oh, hey, I'm 65, I'm really healthy, I want to go with a zero premium or the low premium Medicare Advantage plan. And so I'm going to do that. But at 75 years old, probably start getting some health issues. I might decide I want to jump up or climb up that ladder. Well, here's the way it works. If you start with Medicare Advantage, Medicare gives you 12 months from your Part A effective date to move or climb up that ladder regardless of your health. But let's say at 65, you do Medicare Advantage, and at 75, you call me and say, hey, my doctor decided I need my hip replaced. I want to go to a more comprehensive coverage plan. Now I'm going to say, okay, well, let's try it. But now any pre-existing conditions does come into play. So we're going to have to talk about pre-existing conditions. So that's one thing is very important. Pretty much every open enrollment, someone will call me and say, hey, I'm on a Medicare Advantage plan. I really need more coverage because I have a medical issue. Can I go to a supplemental? Now, I'm not the one to make that final decision because I'm not an underwriter. So I always say, well, let's try it. And then, of course, the insurance company will pull the medical records. The insurance company will make that call. So that's one thing that I really need to make sure that you understand is if you start with Medicare Advantage and you're on it longer than 12 months of your Part A effective date, and you try to move up the ladder, you're going to have to medically qualify in most cases. Now, you can always start with the Medicare supplement or Medigap here at the top, but if you decide you want to move down, you can do that regardless of your health, as long as it's during the open enrollment period. So it's easier to go down than for you to go up. And I just always like to kind of ride that one home to where you understand that particular rule. Once again, I'm just here to educate you and make sure that you understand all of your options. Okay, so let's look at the difference. Let's compare them side by side. So you have your Medicare supplement versus Medicare Advantage. Typically your Medicare supplement, it's more expensive. It pays all or part of the out-of-pocket expenses for the Part A. So once again, it fills those holes of that Swiss cheese. The Medicare Advantage, you typically have copays where you're paying more out of your pocket. The way the claims are processed on the Medicare supplement side, typically it works that Medicare pays first, the supplement kicks in and just pays the second part. On the Medicare Advantage ones, like, let me give an example. So let's say you go in and you have an x-ray done. They're not typically at the counter going to say, you need to provide me X amount of money. They're going to bill your insurance and then send you a bill and say, okay, now you owe this after your insurance is paid. Your premiums, of course, this is, it can differ by A, what state you're in, B, how old you are. So typically it could be anywhere between $110 to $200 a month. Because once again, it depends where you're at and what your age is. Your premiums on Medicare Advantage, there's so many with 0 premiums or low premiums. There's some that's up around $100, but give you an idea, you're typically a lower premium. Your prescription drug plans, you do not have prescription drug plan on the supplement. You have to purchase that separately. Your drug plan here is included. Now, your out-of-pocket cost, if you remember the Plan G that we talked about, remember it only had a $240 deductible. So it was a small amount, not including the premiums. The out-of-pocket here could be anywhere between $3,500 to $10,000, depending on the plan, because it all depends on what plan you go with. Now, with the Medicare supplement, typically you can pick any doctor, any hospital that takes Medicare. So a lot of times people that travel within the US will want that flexibility to say, I want to go anywhere and I don't have to worry about a network. So the Medicare supplement gives you that flexibility. Your Medicare Advantage plans, there's really 2 types of plans that are very popular here. The HMO, which means you must stay in the network to have coverage. If you choose to go outside of the network or their list of doctors or hospitals, unless it's an emergency, you have no coverage. So your HMOs typically have a tighter network. Now your PPOs have a network, but it can open up to a broader network. You just pay more if you go outside of their network. So with a PPO, you have in-network and out-of-network options. So if you're looking at this chart side by side, this kind of gives you a clear picture of the big differences between those plans. Okay, so let's now get to the why in the Medicare Joy process. So the why we talk about is your yearly reviews. And one might ask me, like, well, why should I have a yearly review? I thought 65, I get this done, I never have to worry about it again. Well, just remember, those puzzle pieces are constantly changing. So that's something that you have to be very cognitive of, because things change. So your plans can change. And of course, you as a person can change. Your doctors and your drugs and your income, all kind of things can change. That's why we need to make sure that we talk about having the yearly review. So when you pick a drug plan, every drug plan has what they call a formulary, which means these are the list of medications that we cover. And let me give you an example. For example, last year we had one insurance company that decided they were going to drop the drug Eliquis. So every one of my clients that was on the drug Eliquis, and many of you know what Eliquis is, it's a blood thinner and it's expensive. One of my carriers decided to drop the drug Eliquis. Everyone that was on that drug, we had to make a plan change, because they weren't going to have any coverage come January 1st if we would not have changed their plan. That drug is about between a $500 and $600 drug. So think about having coverage and then all of a sudden not having coverage. You're paying, what, $6,000, $7,000, $8,000 out of your pocket because that drug is no longer covered. So it's very important that we review your plans, because the formularies can change. Drugs are all broke down by tiers, and your tiers can change. Tiers are typically 1, 2, 3, 4, 5. The lower the tier, typically the cheaper the medication. But an insurance company can say, okay, well, you were on a tier 2 paying $10 a month, but next year we're going to bump that drug to a tier 3 where now you're paying $53 a month. An insurance company has that right. So that's why during the yearly review, we look at all your medications. We run it through our program that says which insurance company covers their medications the best, because there's not a specific one that we're going to push. We're going to say, this is the one that makes sense for you. The next one here is the preferred pharmacy change. So all your drug plans have typically a preferred pharmacy that says, if you use these pharmacies, you get a better rate rather than using this pharmacy. Let me tell you this funny story. So I had this client, I was doing his review, and he said to me, Suzanne, everything is perfect. I love my insurance. I love my pharmacy. Everything is perfect. I don't want to change anything. I said, let me check your plan, because I knew there was some big changes. And it was funny because the pharmacy that he had been going to decided to pull out of the preferred list for the next year. So as I was doing his review, I said, well, here, the same insurance company is coming up for you. The same, of course, we're not going to change your medications. We're not going to change your insurance, but will you go across the street to a different pharmacy? Because if so, it's going to save you about $1,600. And he jokingly laughed and he said, well, yeah. And I said, was this appointment conversation worth $1,600? Because we really didn't do anything except for we told him to go across the street to a different pharmacy and it saved him $1,600. That's why it's so important to have these reviews. Every year, your annual deductible can change. So remember when I was doing it before, I told you the deductible was $545 on most plans. That can change. Medicare Advantage plans, they can also change. Hospitals or doctors can say, hey, we're not going to take that plan the next year. Let me give you an example. There's a hospital here in Muskingum County, and this year they chose to not take two insurance companies. So anybody that had the Medicare Advantage plan that was on one of those two insurance companies, they had to change the insurance plan or they would no longer be able to be seen at that hospital, which is a big deal. So with Medicare Advantage, once again, the doctor networks can change. That's why it's so important for those yearly reviews. So that's the value or the importance of those yearly reviews. Now, right before wrapping up here, I like to talk about how we get paid. So a lot of times clients will say, well, Suzanne, if I go in a Medicare Advantage plan and it's a zero premium, how do you guys make any money? Well, I'm very transparent. Basically, the way it works is the Medicare supplemental plan. So the ones we talked about before, we get paid a commission and it equals out to somewhere between depending on the insurance company, 18 to 20% of your premium. And the way it works is we're paid 18 to 20% of your premium for the first 6 years. After 6 years, it drops down to 4%. So if your premium's, let's just say $150 a month, we're paid 18 to 20% for 18 to 20% per month for those first 6 years. And after that, it drops way down to, a very low 4% premium or 4% commission. On the Medicare, and that we're paid the 4% really for the rest of your life. On the Medicare Advantage plans, we're paid a certain dollar amount for your first year, and then we're paid about $250 around that from year 2 till the year that you die. Okay, so the way it works is the commission on the Medicare Advantage plan typically it goes down after the first year, and then it stays pretty much leveled out throughout the rest. So I like to explain that because we don't want in any way to try to encourage one person to buy one plan over the other. We like to educate you and make sure that you're making the right decision. So that's how we get paid. Now, as you can see with the Medicare supplement, the commissions definitely drop off after year 6 down to 4%, and you're not making very much. But we still wanted to take care of you in every way we possibly could. So part of that yearly review, what we have here is we call it our extra care membership. And really what that does is that'll help us be able to take care of you, make sure you're always on the right plan. So you might say, well, do you guys charge a fee to consult with us to begin with? Absolutely not. We have no fee. We don't charge you for a consultation because we want to make sure that we do what's right for you and make sure it's the best option for you. But if you would like to join our extra care, it's $199 a year or $19.99 a month. Now, with that extra care, here's all of the benefits that you receive. So, of course, you went through our Medicare Joy process. You'll have our unlimited phone and email support. But here is obviously the most important one to me. We do a yearly review of your Medicare plan. I just put the numbers together that we saved our clients for last year, and it was $999,000 that we saved our clients. If that is not rewarding, I'm not sure what would be, because that money went back into our clients or your pocket. It didn't go to me. It didn't go to the insurance company. It didn't go to the pharmacy. This went to you, to the client, into their pockets. So when we do their review or do your review, we basically say, okay, you're on this company. We might tell you to stay there because it might make the most sense. But we may say, we need to move you over here and it's going to save you X amount of dollars. So as part of the Extra Care membership, you do get that yearly review. You get the reminder of the annual enrollment. That means every year, and I kind of call us your annoying best friend, because in September, you're going to get an email from us. You're going to get text message. You're going to get a newsletter. You're going to get all these different things to say, hey, open enrollment is coming. If you want us to review your plan, here's what you have to do. Because we want to make sure that you don't miss getting that review. We also have a secure account where you can update your doctors and drugs. So once again, those puzzle pieces, your doctors change, your pharmacy needs change. You'll update your doctors and drugs. I do a monthly live cast where I talk about things that are very important to you, that's beneficial to you. You'll get that contact once a month. You also have access to our billing concierge team. Anytime you have a problem with a bill, anything you receive in the mail that you're just like, I don't know if this is legit or this is a scam, or do I really owe this bill, or this bill doesn't look right. And you want a professional eye to take a look at it and say, oh yeah, that doesn't look right. Let us call the doctor's office and see if we need to get the corrected billing. Now, if you owe the bill, you have to pay it. But we're here to help walk you through it to make sure you're not paying for something that you really don't owe. And also, you also get inducted into our community that has a mission to protect all of our retirees. As you can see with my story, we're here to help. And my passion is to help you when life gets complicated. That's my God-given mission. And my team and I, we work together to make sure that you're always taken care of. So once again, this cost is just $19.99 per month. A lot of people like to do the $19.99 per month, or if you want to do the $199 per year, you can do that. So that really is the end of it. I do see a couple of questions. Here is our contact information. If you want to take a quick picture of it or whatever, this is our contact information. I have to apologize because I did not introduce Tisha at the beginning of this. Tisha is the other advisor here at NUMA. And if you call in or you have an appointment, typically you'll talk with her. And it's completely my fault. I completely forgot to introduce her at the beginning. So I'm going to go ahead and have him, let me stop sharing my screen. And I'm going to have him put the slide over on her so she can say hello and introduce herself.
Hello, everyone. I'm happy to be here, and I'm glad you could join us. And Suzanne, I do have a couple of questions. Let me know when you're ready for those.
I'm ready. Go right ahead.
Okay, so I will be turning, or no, wait, my spouse will be turning 65 soon. I'm 60. I'm on an employer plan. Can I make contributions for my spouse on the HSA?
Okay, so let me make sure I understand. So it's the person that's 60, it's their employer plan.
Yes.
Their plan. And
Yes.
the spouse is on their plan as well.
Yes.
So that is one rule that, like, that's why I said when I was going through it, because there's some differences, variation. So if you're the actual employee and you're 60 years old and your spouse is 65 or whatever on Medicare, and they're on your plan, as long as you as the employee, it's your employer plan, you can contribute for that. You can contribute for your spouse that's over 65, as long as you are the employee that's under age 65. That's a good question, because we get that, and it's kind of confusing when you start digging deep into it.
Okay. I noticed on the slide that you put up that there was a Plan F that covered more than a Plan G. So why wouldn't you recommend an F?
So the Plan F, in January of 2020, they did away with that plan for any new people turning 65. So if you turn 65 prior to January of 2020, you are eligible to go into that plan, which typically doesn't make sense cost-wise. And if you already had the Plan F, you get to keep it because you're grandfathered in. But January 2020 is when you no longer can sell that to people that are turning 65.
Suzanne, I will be turning 65 in September. If I wanted to call your office for a consultation, is there a time frame that I need to call, or could I just call today and make an appointment?
You can make an appointment, or you can call oh, yeah, sorry. You can make an appointment or call today, make an appointment. But here's the situation is we typically won't do it till 90 days before you turn 65, because 90 days before the month you turn 65 is when you're actually able to go out, sign into Medicare, set your Medicare up if that's what, you know, the decision we make. So typically we like to do it within 90 days. If you call our office, sometimes we'll say, hey, you're a little bit too early, but we'll call you back 90 days before. If you say, I just want an appointment and on the calendar, so I know it's calendared 90 days, we'll go ahead and make the appointment. And then of course, we'll remind, keep up with you over the next, let's just say 4 or 5 months, just to make sure that we're getting everything taken care of.